And now we start with Madagascar, where officials are struggling to contain a widespread and deadly outbreak of a plague that's been wreaking havoc in the country since late August. And there, at least 45 people are reported to have died from the outbreak, with more than 343 more infected since last August. Madagascar is said to typically experience around 400 cases of the bubonic plague each year, and with the illness spreading through the flea bites and contact with infected bodily fluids. According to the World Health Organization, WHO, cases of the plague typically begin between September and April, but the current outbreak is different and is reported to have started even earlier and has struck in major cities like Antananarivo and Toamasina. A majority of the confirmed illnesses are said to include cases of pneumonic plague, which can be transmitted through the air when an infected person coughs, and if left untreated, could result in deaths.
In response, the Malagasy Red Cross said it mobilized 700 volunteers to work on community education, tracing people who have been in contact with plague victims and other health initiatives. On the ground, authorities have been taking measures against citizens spreading false information about the outbreak on social media, including at least one arrest of a false report posted on Facebook, according to the BBC. Now, last week, the World Health Organization delivered 1.2 million doses of antibiotics to the island and authorized about $1.5 million in funding to help combat the illness. Authorities have placed a ban on large public gatherings in the capital, where the government has been working to disinfect school classrooms and hand out surgical masks. Prison visits in the worst-hit areas have also been suspended. Now, joining us on phone for more from Brazzaville is Michel Yao, Head of Emergency Operations at WHO Region Office for Africa.
Hello, Mr.
Yao. The death toll of the victims is rising, while the government says it has taken measures to cope. What is going on in the fight against this epidemic?
Well,
thank you very much. We can't say that there's anything going wrong, but the epidemic this year is a different strain. There are two types of plague, and this year's is the most contagious and has affected many people. So this is what has caused its rapid spread and the rising death toll. But these figures also indicate that the fact that teams have been deployed in different homes and are actively seeking to detect and treat patients, because it's a disease that can be treated by taking antibiotics. It can be cured if treatment is administered much sooner upon detection. Currently, there are roughly 500 cases that have been detected and about 55 deaths. And it makes about 11% of fatalities. Now, in other words, out of 100 people who have contracted the disease, about 11 people are unfortunately dead. Now, the main thing is to provide the necessary medication, to train doctors in order to be able to treat patients, since it's a disease that can be cured with the right kind of treatment.
Now,
since the 1980s, there's always been a breakout at this time of the year in Madagascar. Now, is it a sign of negligence on the part of authorities in taking preventive measures? Well, currently, plague at the moment is manifesting acutely in certain countries, Madagascar in Africa, but also we have some countries in Asia. Now, the main challenge is that it generally occurs in rural areas. But this is the first time that there's an outbreak in a city. and that is in Madagascar, and medical authorities have good experience in terms of prevention and management. There are measures that were established a long time ago, but what surprised me this time is the spread of the pulmonary plague and the fact that a person has to travel from far areas, such as the rural areas, to come to town to get treated. Now, if the health services authorities had been forewarned and the person taken to a center for treatment, there would not have been any cases reported in the city. Now, it is such matters that have complicated the struggle for health authorities in the city, who have experience and also managed to control the disease every year. Now, you mentioned several strains of the disease. What are they and how dangerous are they? Now, in Madagascar and Africa, there are two types that manifest. There is what is called the bubonic plague. Now, it is the one that reaches the lymphatic system. It translates to some type of big nodules in the lymphatic system, and if not treated, they become infected and may lead to death. However, it is much less viral than the pulmonary plague. The pulmonary plague is the second type. That is the second type that reaches the respiratory tract and therefore can cause death much more quickly. It's a disease that when contracted, in about 1 to 7 days, symptoms emerge and can result in complications and lead to the death of a patient. Now, this time in Madagascar, we still have both types, but the pulmonary plague is more predominant. More than 60% of the cases reported are pulmonary, which makes the situation much more complex. Thank you very much, Mr. Yao, for speaking to us.
Toutes ces explications concernant l'épidémie de peste à Madagascar.